Thank you very much, Speaker. My question is for the Premier. McMaster Children's Hospital in Hamilton is seeing a dramatic increase in children seeking medical help for mental health issues. This past fall, twice the number of children were in with eating disorders and substance use issues, while the number of youth being treated for suicide attempts has tripled compared to the same time this time last year before the pandemic. I hear from families across the province who have absolutely nowhere to turn. Before the pandemic, access to mental health services for children and youth was already at a crisis point. Now we're seeing the demand for mental health services rise even higher as the pandemic continues. According to Children's Mental Health Ontario, there were 28,000 children and youth on wait lists 2.5 years long for mental health supports. Speaker, my question is simple. What is this government doing to protect our children and youth in the province of Ontario as this pandemic continues to drag on?
Minister of Health.
Thank you, Speaker, and thank you very much to the member for the question. We are certainly well aware that there is an increased need for mental health and addiction supports, not addiction so much for children, for adults, but for mental health supports for children, youth, adults, as well as seniors. This is something that we have addressed with our Roadmap to Wellness, which was launched just before COVID struck, but we now know that as COVID itself, we deal with that physical aspect of it, the mental health issues will remain for many years. So we have been helping our children mental health supports by increasing their funding by 5% last year to allow them to hire more staff to be able to reduce their wait lists. That is something that we are working on today. We will be having an announcement very soon about additional supports that we're going to be putting into this sector because we do recognize that those needs are acute and the wait lists are long.